Hi all, this is Dr. Abhraleen welcoming you to yet another video of Denta Cure. Today we are going to discuss about some of the medical emergencies, or rather dental emergencies with your kids at home, how you are going to respond to them, and what are the things you can do at that time of such an emergency. So first things first, things that we have to keep in mind is in case of dental pain. So it can sound to us simple, like only a dental pain, but remember, every dental pain has started, it has a source or an origin from a cavity which has been neglected for a long time. So pinpoint the part where the patient is complaining of the pain. Check if there are anything, food or anything is getting stuck there or not. If you can, do brush or clean that area, and the next best thing you can do is contact your nearest pediatric dentist and take your child to the doctor, because that pain, that tooth has to be addressed and the reason for the pain has to be removed. Another point is, many times after maybe a treatment where we use a local anesthetic, or even normally a child can complain of a lip bite or a cheek bite and bleeding from that associated region. In that case, first check where it is happening, stop the bleeding by applying some kind of pressure with a gauze or a clean cloth, and try to stop the bleeding and try to contact your nearest pediatric dentist and do get the child to him, so that again the cause of the injury can be checked and solution can be done. Next is a case of a broken tooth or an avulsion. In such cases, many times due to falling on the ground or during playing or some kind of contact sports, your child's permanent tooth can come out or it can get fractured. So first things first, if there is any kind of bleeding, clean the area and place some kind of pressure once again to stop the bleeding. Now you need to find the piece of tooth which has broken or come out and try to place it in a bowl of milk. That is the most used food item in our home. Place it in a bowl of milk, or if you are not getting it, just try to keep it in a bowl or in any container of your own saliva, the patient's saliva. The tooth should be kept there, and you have to run to an emergency setup, to a dentist or a dental clinic somewhere near to you, and the doctor can check the condition and will definitely, there are certain methods by which we can reimplant that tooth. So try to not delay once there is an avulsion or a part of the tooth have broken or chipped out. In case of a primary tooth or a milk tooth, if a tooth comes out as a whole, as an avulsed tooth, generally we as pediatric dentists, we do not try to reimplant them, because there is always a chance of traumatizing the permanent tooth bud. So in those cases we leave them, but you make sure to take your child to the doctor so that he can give you the best possible remedy of the treatment. Another thing is, like during playing, or the child may get into a fight with his friends, his or her friends, and might get a severe trauma to the head, or in some cases maybe a broken jaw. The only thing you can do is take him to an emergency setup as fast as possible, because if the child has got a blow to the head, we might need to do some radiographs of the brain and check whether the child is being conscious or it has fallen unconscious. But these are some extreme cases. Sooner you take the child to an emergency setup, the better it is. And at the very end, I would like to say, any kind of mishap, any kind of emergency can happen to our children. We must be aware, we must know what is to be done at what point of time. Try to share this video with your friends and family, and especially with parents who have little kids at their home, because people should be aware how to save their kids in case of an emergency. I talked in depth about dental emergencies, but of course we are here to help you and there are all the dentists who are there who are trained to help your child in such kind of cases. Do not neglect your child's oral health and overall health, and try to give them the best treatment that is possible. Thank you. Stay well. See you soon.